Hey, everybody, welcome. Thank you for all coming back, and thank you to my very special guest, Danielle. Danielle Worthen Cullumber here with me today. She is from Willow Medella Wellness, and I'm going to let her tell you all about herself because I hate reading intros, as you guys know. So, Danielle, what I do is I ask people to introduce yourself, tell us what you're all about, and tell us what you're really interested in and what's got you fired up right now in your life or in your hobbies, is for some or interests like things we were just talking about. So go, it's all on you.
Well, I'm Danielle Worthen, Cullumber. I'm a trauma therapist. I'm an LCSW, so I'm a licensed clinical social worker here in Utah. I am the founder and CEO of Willamette Wellness, and my love and passion is bringing trauma healing to individuals, especially those of the unspoken, of the paranormal, and usually marginalized discussions that people are afraid to even talk to even their therapists. And we bring in the holistic practices in. So my love is bridging that gap and bringing that lived experience to the person so they can feel complete again.
There's so many things in that sentence that just or that statement that just we have to pick out. Um, but so okay, so what's got you fired up? What are you excited about you have going on in life right now? Or are you just juiced up by your work? And because a lot of people I get on here they're just jazzed by what they're doing in this.
Well, what's exciting is right now I'm just starting my last two semesters in my doctoral program at Simmons University for social work.
Oh, good
And
for you.
while I'm doing this, I am also integrating the most recent, up-to-date information for trauma healing and also bringing that voice. And we're also decolonizing that lens of we and that stigma that the medical model has blocked us with. So we're bringing more of that holistic healing, the energy, and but we're also having to tiptoe around this sensitivity of those labels of diagnoses because we get stuck in those narratives as well because of those stigmas.
Yeah, I hope that lots of people are not only listening but also watching because Danielle's face just lights up when she talks about this. She's got a big smile on her face, and you can tell how into it she is. So that's refreshing to see. All right, so first and foremost, the medical model. When I talk about the medical model, there's two ways that I talk about it. Number one, it's a model that unfortunately is adopted by some agencies that I've seen in particularly the mental health arena and in your arena, for instance, with trauma and neurological disorders and things along those lines. Even in medical, right? Medical model where we're talking about people who are um, for whatever reason they have accessibility issues, they have mobility issues.
Mhm.
So the medical under the medical model, traditionally, it is you get up, you drive yourself to the doctor's office, and you go in and see that doctor. The other medical model that I talk about is this reactive process that we've adopted in Western medicine, where we talk, you come to the doctor when you're sick rather than getting out in front of it and trying to stay well. Both of them, I think, are just our medical system being driven by big business, and it's big money, and there's big responsibilities on these physicians and their staff to make numbers and pay the big nut to run the office. Um, when you talk about the medical model, which of those two or all of the above is that what you're talking about as well?
Pretty much the whole. To summarize it, when I said decolonizing that lens, it is literally also the medical model of that because that's those barriers that we create. Because back in the old days, when I mean old days, in 1800s, you went to the hospital, and if you got diagnosed with a terminal illness, they would get you dressed and send you out the door because numbers wouldn't pay the bills. They would get funding for how many people that they cured. And if you were on a
Hmm,
death sentence, you were sent to the street. And
that's
and it's
interesting.
not too still far from what we do now sometimes. Because when we don't give them access to care, regardless of uh, accommodations or not, or even those labels, because pharma and insurance say somebody looks at it and goes, "Oh, I don't want that's too big of a bill." And yeah, we have all the proof that you need this, and we can say the approval. Some low totem person, it's like, it's not going to be my quota. They can deny that. That creates those barriers.
Yeah.
And as a mental health therapist, I'm not just a trauma therapist. I'm a social worker. I also have my background in recreational therapy, so I was working with the geriatrics and those with special needs, both physical and mental. I've seen those barriers. The accessibility is still a problem ongoing, and that continuates the trauma of these medical models still banging against
Yeah. Yeah. Banging heads.
pretty much. And it fires me up when I see when people need support and access, and it's like, no. I've had my own experiences where I had to go around the systems to get support for my own child who
Mm,
ha wasn't diagnosed until she was adult with autism, spectrum disorder.
right.
And the only reason why she didn't get a diagnosis for a couple of reasons. One, back when she was 5 years old, insurances were purposely, intentionally denying any potential services if that diagnosis was linked to anything. So I was like, screw this. I'm a social worker. I'm going to use my resources. I was using the resources I was giving my clients, and I targeted her symptomologies like her delayed speech, her emotional disorder,
But what
those
did
little
they say
things.
that it was attached to deny it?
Well, I didn't get her a diagnosis. That's the thing. I was
Okay.
seeing this consistently, and I was like, oh, we have a problem. So, well, and because the medical model, they weren't talking to people. That's the other thing
Yeah, yeah.
is the systems don't talk to each other. They're trying to get better, but every time they have a way to communicate through a portal or network, it they redo a whole new thing. I go in, I'm like, fill out a paperwork.
Every
So
time.
every time, so
And this is, oh my God. People who are listening right now are probably so sick of me saying exactly what you just said because I say it all the time. It makes me nuts. There is no, the portals are just that.
ridiculous, and that's not accessible too because people who can't see or hear and their phones. I mean, I have
Yeah.
to wear glasses
Yeah.
now to look at my phone. I mean, it's
I
and
know.
and, and it's my nightmare. But going back in the day, in the early 2000s, with that just that stigma of they potentially could have autism, doors would be shut down because they didn't understand it and they weren't willing to pay out the monies. Now they will.
Right.
So I targeted those symptoms, the symptoms my daughter had, gave her skills because I had been studying it as a social worker for years, and I knew the trauma that can happen by these things. And luckily, she grew up on her own, making her choice to get the diagnosis for herself. Because she also
Good.
came from a lens that she didn't want the label. And that's the thing. Once we have a stamp of this terminology of autism, neurodivergent. Back then, the doors closed. Now we can actually use it more because most of us are now finding out we're neurospicy. I call it neurospicy because we have
Yeah.
different kinds, different flavors. Some are hot, some are not.
I
I'm
like that.
neurospicy.
Neurospicy. You
I'm
are.
neurospicy.
I wish it was one of the Spice Girls. It's Neurospice.
Well, that's actually probably where I got it from because that I love the Spice Girls. Um,
Um, but let's talk because what you're bringing in here that is so important is not only your lived experience, but the lived experience of clients that you're working with. Because we can get trauma informed, and we're going to talk about what that means. But we could be trauma informed. We could acknowledge trauma as being a factor in our personality and how we move through life. And it has been shown and it is proven that it impacts generationally and it impacts mental health. It can be the trigger that gives an onset to a major mental illness. But it's not something that you experience an event and it goes away. So explain what trauma is for those of us who don't fully have a definition of it.
This is actually the simplest way to put it. Okay, most people know post-traumatic stress disorder. And when I talk to people, they're like, I don't have PTSD. I'm like, right, I didn't say you had PTSD. We all have incidences where we don't respond well to a situation. And within that situation, our body and our mind respond to it, including our emotions. And that becomes a core moment to us. And sometimes we get stuck in a loop based on that event. And trauma is funny because they used to think that babies didn't feel pain or in utero. You can actually have uteral trauma from whatever your mother was experiencing or the environment she was
Oh,
exposed to at that time.
sure. Yeah, I mean
And
that blows my mind. That's one of the things I'm talking about. It can be your mom experiences something while she's pregnant. While you're in utero, you get a bit of that trauma passed on to you.
right.
And they're saying that this can go on for two, three, I've heard up to 5 generations that trauma can be passed on genetically. It's fascinating.
Yes, because our cells mutate based on that. It
Yeah.
accommodates. It becomes part of the network rhythm of what we respond to things. So if you have anxiety, well, I bet you can go 4 generations back and go, uh, grandma had
Yeah.
anxiety and she was put in a institution. Well, she probably didn't have anxiety until she something happened and well,
In
women
the
didn't even have
institution.
rights and they got institutionalized. Like
Yeah.
those fears and those ongoing stories. And that's the other thing. The generational trauma can actually be even the stories of what happened to someone. They're like, I
And
don't want to that happen to me. And then you spend this time trying to avoid something that you
yeah.
heard about but don't have any proof about. And
Yeah,
that even goes,
the tape loop in your
yeah,
brain that keeps you.
exactly.
Yeah.
So, and that's the other thing is we also fear our end of life for if somebody becomes incapacitated and they need some support, maybe from a temporary illness to long term. We have caregivers who are not able to regulate, and that's trauma too because they don't know how to take care of themselves because they're worried about the person they're caring for. Statistically, the caregivers die before the person dies that they're taking care of.
Is that right?
Yeah.
Statistic. I did not hear that stat. Oh my gosh.
If I had the actual current numbers,
That's hard hitting.
yeah.
That's hard
Well,
hitting. And that it's also tragic, right?
yeah. I mean, the sad thing is, I was actually on the ground floor seeing this in real time. I started. My stepmother here in Utah actually wrote the handbook for the training for this certified nurses and assistants. And since then, they've probably evolved from since then. But I was trained to be a CNA, and I hurt my back well
Hmm.
before I was properly trained, like lifting and stuff. But I found a love for it, and I became a habilitation therapist, a recreational therapist, and everybody that I kept seeing the story was the same. The caregiver burnt out.
Hmm.
They felt
Hmm.
guilt. They would get sick, and they couldn't take care of their loved one.
And they don't take care of themselves and they get sick and they can't take care of the loved one.
Exactly becomes
Then
this
they feel
ongoing
guilt
story.
about that and then resentment. And it's just this,
Right.
yes.
And that goes back into that still that model too of if I can't do it, no one else can better than me.
Yeah. Yeah.
And then we have this lens because in some back the care systems is getting better, but they're not better.
Yeah.
I,
I
I
know what
used
you're
to tell I used to tell people when you go put somebody into a care facility, even temporarily, look for a certain book. It's a book that the states have to go in and for certification for investigations, and they will flag any discrepancy, and then they have to do a follow-up. And they have it out front, supposedly. Technically, they're supposed to kind of like your license and stuff of the building. Nobody's told to look in those. And I said, if you looked, you'd have found out the reason why your loved one died was the very reason what they got flagged for. And I broke my heart because I had to tell a great aunt's daughter why she passed away. and I'm even emotional to talk about because
Yeah,
I
I
knew
could
this
tell.
stuff and I couldn't even prevent it because
So wait, explain this to people so that because I don't understand it. So there's a manual that
hmm
facilities have,
yes.
and
Well, here,
and the
at least in
patient.
the state of Utah, I can say.
Okay, all right.
So the states have to every year they do a surprise inspection. They go through all
Yes.
the notes, the medication, they go through the logs, they interview the clients,
Jaco.
and yeah, yep, that's the
Yeah.
same thing.
Yeah.
And they have a binder that shows what they passed on and when they didn't, and what
What
they
their
had to
strengths
prevent.
and weaknesses are. Okay, so
Pretty
it's
much.
the federal Jaco reports that allows them to continue to get the funding.
Yeah, and not all of them have J code though. Some of are just private residentials, and they still have to go through
Right,
the same
right.
licensing and
Yes, yes, yes.
inspections.
Okay, yeah. Huh. And if they're not good or strong in one, they may pass, but they got to do. There's
Yeah, there's
like a
because otherwise they
consent
get fined.
decree. Yeah, yeah,
So what's interesting is I will have been at care facilities that got sold and resold and resold and resold. They can put a beautiful paint on the wall,
yeah.
but until they fix the administrative structure and the funding,
Right,
it doesn't work. I've known people that have stayed at the care facilities because they had more guilt of the care discrepancy for the clients, the residents, I should say, because they live there, the residents, and they won't leave because they're like, no one else is going to take care of them.
right. So they're working there for longer than they should because they're just worried about what's going to happen with their patients
And they're
if
burned out.
if they leave. Yeah, God, that's
Yeah.
terrible.
So my
Um,
background's big. If I mean, I can talk
yeah, I
about
guess
health
so.
services too. I'm
Man, we
like,
got
I've
a lot
seen
of
it all.
things we got to talk about. You'll definitely be coming back here.
Thank you.
But all right, so let's get into a couple of specific questions. What's the difference between traditional care and trauma-informed care?
Trauma-informed care is putting the person that you're treating first. It's about what they want, what they're asking for, and you don't, and you're coming from a lens of compassion and sensitivity. The problem with most care is we already come in with a bias. When we walk around, we already have a bias to something because we have these ideas. But the person who's at the center of it is the important part, and they need to be met where their need is. We're not starting
Right.
over.
We have to have a client-centered approach.
Right.
But what if the client doesn't have trauma per se? Or
Well,
do
that's
you
the
approach it
thing.
as if everybody has trauma?
Well, everything should be handled as if we all have stories,
Yeah.
and our
Yeah.
stories have their own version of a trauma. What
Okay.
they think is a trauma may not look like a trauma to me.
Right.
We might
Right.
be in the same event, and from our lived experience, that could be received differently. So coming with a trauma informed lens is knowing that compassion, autonomy of choice is the biggest trauma that can be happen for a person. When that they feel when that choice and that autonomy is taken away,
Got it. That's
and
traumatic to them.
that's traumatic. Let me ask any of your listeners or even watching, I bet you they can just a flash in their head, they could probably have a memory of a time when a choice was taken from them or they were not listened to. Even
Hmm.
if they were wrong, they were still not listened to. That's traumatic because then you don't, that trust has disintegrated, that the relationship to healing gets distorted, and then we get these blinders on like the Clydesdale horse is like this is the only way we have to go,
Yeah.
and somebody
Yeah.
else is driving the stage.
Right. So whether I tell you my story or I don't tell you, if I tell you my story and you just brush over it and let's just get, okay, thank you very much for that. That was interesting. Now let me take your blood pressure. Let me stick a
Hmm.
thing under your tongue and just move on because that's what medicine as we know it, that's what they do. They check your vitals
Right.
and all that. So in a way, that is well, that's non-trauma informed. It's sort of generic. It's sort of cookie cutter.
Absolutely, that's why it's called a model because it is a cookie cutter format.
Right. Yeah, yeah, yeah.
I even said that I created coping strategies myself to help my bodies regulate. that can happen within 20 seconds of just breathing, grounding, something.
Yeah.
Because I put it together because my neurospice brain needed it. I was trying this for years with my clients. And the fact to just being able to get my body or my clients into a state where um, they're not in fight, flight, or freeze anymore. So they can get
Right.
back in their executive function, which is I call the boss brain because we're thinking more clearly. We're able to
Yeah.
observe more. We can actually be able to talk because people shut down. They go to the doctors. I have people go to the dentist and they're having a panic attack just to open their mouth. I mean,
Oh,
they're,
sure.
yeah,
And my
those
daughter
those
used to be
emotional.
like that, man. She was, I mean, she would experience a traumatic event going to the dentist, man, when she was little. Yeah. Yeah.
And there
So,
doesn't need a rhyme or reason why we have those responses. It's our
yeah.
nervous system activating, and our body actually are the best regulators. It just needs some help sometimes. We have an on switch, but not an off switch.
Yeah.
And
Yeah.
those stressors of the day to day, the
Right.
stressors from the day to day, it's so normalized. We didn't realize that's even still trauma. I mean, how many of us go, "Gosh, I look older than our age," and they're tired? Well, our bodies aren't thriving; they're just surviving.
Yeah. Yeah. Well, I love that we our bodies have a built-in on switch, i.e. dopamine, adrenaline, but we don't have the off switch that's going to kick in for
Right.
when we need it to. I mean, it'll all, things subside, but we need to, as you said, and I'll be the first to tell you, I'm not good at this and don't practice it, but we need to get into a rhythm and then the habit of creating that off switch uh, cognitively and be proactive about it, and overtly create that off switch, and that's huge. But when you have families that are in a traumatized system, right?
Mm-hmm.
And now, so a trauma happened within a family, or let's say a major trauma. Let's not say a perceived trauma by one person. Let's just say there was a traumatic event, and including a major illness. Because I think a major illness, particularly uh, an illness or a diagnosis that's going to be extended, prolonged illnesses. Um, how does that manifest itself throughout the home? Not
Mm,
just with the person that went through it. And if you want to talk brass tacks, and this is the most traumatic thing I can think of in our world is a woman being attacked, raped. I mean, I can't imagine anything that would be more traumatic. So girl comes home to her family after experiencing that heavy trauma, and she's living in the home. How does that trauma, and again, I'm trying to be sensitive about it, and I know that that's not something that we should even make light of, but for this discussion, I'm interested in knowing how trauma ripples out from the victim to the family, and how the family has to adjust to the trauma. Now we have a trauma of our own, right?
right. Well, it's ironic that you brought this up because I actually have a lived experience of that.
Oh, I did not know this. Okay.
And the reason why I'm smiling is because this is part of being trauma informed is that even though I'm a clinician, I have references of my own clients. And so when you talk about, like you were talking about the family thing, the family is an ecosystem, just like our
Sure it
body's
is.
an ecosystem.
Absolutely
Okay.
it is. Yeah.
When one thing goes off, it tilts. So what you're going to notice is even with the healing process too. So when we have a family that comes in and goes, the we're having problems, we have an identified client, but we could call the family the whole client, but we work around the one person. And as long as we're checking in with each of the family members and seeing how they're responding and how they're processing, we can actually create a healthier connection so it doesn't disrupt too much. It's still going to disrupt, but everyone's going to be going through a new. And
Yeah.
like no, most of us, we don't like new. We like the idea of new, but we don't like the feeling of new
Yeah.
because it feels unsafe because it's the unknown. So you like um my own experience was because I'm a trauma informed person and I got trained, I knew what I needed to do. That's a rarity. I was like, I go, I had to ask, I need these things, but I can't do it by myself. And
Interesting.
that was those things. But there's people that shut down. I'm going to say the victim. The victim will internalize everything and try to protect everybody.
Sure.
And that's a whole nother system. But then you have the people on the outside going,
The
something's
victim is
wrong.
protecting everybody else around them, even though they're the one that went through the trauma,
Yes,
the traumatic event.
right.
Everybody's going through a trauma of sorts, but the traumatic event, the actual traumatic event, that victim is trying to shelter everybody else from their own trauma and their own traumatic event. It's just mind numbing. It's
Yeah,
the layers are
because
insane.
because it's a protective capacity. Like if I put my trauma on somebody else, then I just traumatize them. So then it repeats, and so it's like kind of like
Right.
a like like goo, like that you get sticky goo on your fingers and you touch it and everything gets sticky. That's
Yeah.
almost how it is. But we also, but here's the nice thing is, if we actually are gentle about the situation, may it is somebody's own experience, we don't always have to talk about the big thing. Just check in to make sure that, hey, are we not just are we good? Talk with each other, not at each other. Don't say, if I was in that position or I've done it. That happens so many times. We can loop and say, I would have done it better. I'm like, not unless you're in the situation. You
Right.
don't have a clue, people.
Well,
And
no, and
until you,
everybody's as you said earlier, and multiple different times already today, and in different ways, that is. Um, Everybody's learned experience, and every event is different. We translate something that happens. The other night I we had an earthquake, right? First time
hmm
I've ever felt one. Like I've heard them in a weird way, but I've never been in one where the house shook. Well, I mean, if that scared the hell out of you and you were really, it impacted you, I thought it was cool. My dog didn't even wake up, but somebody could be really scared and impacted by that. So, and I want to get into that too when we talk about some of the paranormal approach
And I
too.
was actually just going to bring that in. It's like because
Yeah, yeah, no,
this kind of conversation actually goes right into the paranormal stuff because one person can be having a full experience and nobody else is understanding it.
yeah,
And that's even
yeah.
traumatic. I mean, I
We got
think
to
when
have
the
a whole, I think we have to have a whole, folks that are listening. I love paranormal stories. I've had a couple of paranormal stories of my own where people that I loved had passed away, and I know that they reached out to me only twice in my life. I'm not a medium or anything like that. I don't claim to be, but I believe in that stuff. I love it. I get as much of it on TV. And I found out that Danielle's really into it too. And we're going to talk more about that. And she uses it in her work. But before we get to that, I want to make sure that we nail down this trauma and how it
yeah.
looks in a family. How could it manifest in a family? So you have mom, dad, uh, and two kids, and there's been a traumatic event. What could that trauma, just by way of examples, what could may some of the things be of that trauma manifesting itself?
Well, sometimes you also got to look at the family before and the after. So you
True.
actually can get a kind of a baseline where they were at before and after. And that can start showing signs of what's happening. So let's say you have one kid, maybe it wasn't the kiddo that was affected, but the kid is very hypersensitive and hyper aware and maybe a little neurodivergent or a lot neurodivergent. They're going to respond quicker in the equilibrium going off because
Sure.
consistency
That makes
is kind
sense.
of
Yeah.
like helps. But there are also the tones of voices in the body language. When I say tones and voice, because 90% of our communication's unspoken. How is our body language interacting with people? Are you being closed down? Are you being clean? Are you isolating? Or even over dramatically changed something like you're hyper aware to things. And then, of course, our tones of our voice is like, how are we talking with each other? Are we being more abrupt? Are we being sharp? Or are we being more? I'm going to say this. Moms can relate to this, so, or some dads too. So I don't want a gender type. That sometimes we will overcompensate something when we feel there's a lack. Like
Hmm.
we'll start buying toys if we don't feel like there's enough time. We're not given enough time. So if we're traumatic, you might if something's happened, parents could actually be like, I can't let you go see so and so anymore. You got to stay by me, or oh, you've been hurt. They start gifting, like we got to feel
Really, yeah.
whole, like we got to avoid. We can't talk about those things, those hush hush things. We no, we don't talk about that. Or oh, that was experience, or they dismiss it and tell them it was something else that happened.
Mm,
That
mm. And,
goes. If
and
it does that sound like the medical model?
yeah, well, yeah. I mean, let's blow off that, and here's the medical reason for why this is going on with you, kind of a thing,
Right.
right?
So what
Yeah.
I'm saying is we learn from our environment. So if people that are supposed to help us in the medical field or even police officers, now I'm not saying police officers aren't bad, that just to see these situations, or if a social worker came and talked at you, not with you,
Hmm.
you're gonna bring that very same experience into your family dynamic when something happens like this. And there will be an increase in sicknesses. You mentioned illness. Well, other people will get sick because the stress alone will actually cause its own sickness.
Yeah, it's just fascinating to me, and how and that impact on family. So how do you go in and work with the families in these situations? Or do you just work with the one individual, or do you have the opportunity to work in the whole environment, the whole ecosystem, as you call it?
Yeah. The ecosystem. Yeah, I had that Cheshire's cat smile just come on
Yeah, you
because,
did completely.
yeah, because some of these barriers I've actually been addressing in real time right now. I actually, with some people with special needs or can ambulatory, I actually go in the homes with the families. I do therapy in the home. I can meet
Yeah,
with the client or as a whole unit. I also have individual therapy with individuals or even couples counseling. We even do family therapy without client present to help support the
sure.
parents and
I think there's value there for sure.
and
Absolutely.
so one of the things that I learned a long time ago was there's only so much you can do in office.
Yes.
And that's actually why I ended up becoming a social worker, because when I did recreational therapy, I was in these residentials and I was like going, I feel like I can do a lot more. I was taking people out in the community
Right.
and I was doing games, but I was known as the diversion therapy. It's
Well,
like,
don't they call
no,
that
this was,
ecological approach in your lingo?
yeah.
Is that what the ecological approach is? No, I'm serious. I don't know. I mean, I'm not a, I'm only parroting words that I've heard my clinical
No,
staff
you're
use
right. You're
off
right.
of.
But not
Yeah.
everybody understands that lingo. So
No, no,
I
I know. I know. I
so we
know.
default to what we know.
Hmm.
But when I was working with people in the care facilities, they were still stuck. This was their environment. The whole residential place was their ecosystem and their family, in better terms. Or those who were institutionalized, I should say, too. I went and was like when I tried working with legislations, things like that. But when it came down to it, was the individual and the family, the core unit that impacts everything else.
Yeah.
So by offering me to see people in person, even by telehealth, I think COVID, even though it was horrible, it really did push a platform for this virtual stuff, so people could actually connect to those they don't couldn't talk to across the United States or even the globe, and see a doctor to get a medication prescription refill instead of just coming in and go, oh, here's $60 of copay and
Yeah.
gas and
No, it's
time
fantastic. It
off.
really is fantastic, and it's made it acceptable and commonplace. I agree with you there. Yeah.
So I'm bridging, finding those gaps and finding where we can actually offer that better.
That's great. That's great. Now, are there certain tools, language, techniques that you use more often than not with families that are struggling with trauma within the ecosystem?
The yes, and I'd always walk in and say, we're all in an ecosystem, like a petri dish or anything. But
Yeah.
one of the things I do is I actually, when I meet with a client, I always talk about um, they are the expert of their experience, their
Yes.
model, their body, whatever. And I have tools. So One of the things I let my clients know is I will never, ever, ever tell you what to do. I will always ask. And that's a big thing. I will always ask. The moment I tell somebody what to do, it's no different than me if somebody told me what to do. I'm like, whatever.
Yeah.
I'm like, whatever. I mean, how many doctors do this? I'm like, fine. And then
Yeah.
I put the script in, like, I'm not doing it because it did not help me. I did not feel validated. But me asking it, I'm connecting with the person. And I'm also letting them know, though, even though I'm asking if there's something for treatment that I think might help, please tell me if it doesn't align or you don't want to do it. We'll talk about it because there might be a better way for me to support you.
Right.
And and me just giving them the autonomy to be able to speak. And I also go with this a step further is, those moments where you're like, let me to explain this way. I don't know how many people have talked on the street, just even just that. I'm like, hey, tell me how you understand from your lens, because
Right.
I need to know from what you're experiencing. Even if you don't understand, just tell me how you're processing
Well, I
it.
think that's why it's important that we set out the protocol here to say, okay, what is our definition today of trauma? What is our
Right.
definition of trauma
So
informed?
and then I go, if I have a question, I will ask. Not like, oh, just because I know what trauma looks like. That's the thing is, I will also like going, hey, if I'm seeing something, I'm going to do a psychoeducation about it. I'm going to tell
Yeah.
you why this is happening, what's going on, the biology, the process. And then once you become aware of that, you have an observation. Your body's nervous system starts to relax and starts putting the dots together. And all of a sudden, that trauma shifts to healing.
Yeah. Yeah.
So
Well,
my
at
word of
least at the
trauma
very, the
is
very, I was just going to say the very beginning of it is that understanding of, here's how I perceive things, here's why you perceive it, and you can gives you a basis of understanding to build off of, right?
right.
Yeah.
and and having a conversation with yourself, and that's the other thing is having a conversation with yourself is you need to understand what you are needing and wanting, and coming in with I don't know is still an answer.
That's a
That is
good point.
important, starting where you're at and being aware of that. I have people that go, I had childhood trauma, I had sexual abuse, physical abuse, and all the stuff. And I'm like, but I've worked on that. I'm like, okay, we won't touch that. But then when things start happening in their day-to-day life where they're struggling with relationships due to attachment issues, relationships to anger management, we can actually trace it back to some of the stuff that you experience from these moments in time of growing up, because a good way to look at it, I love telling people about Erik Erikson's stages of life because
Yeah.
he's a theory he's a Freudian theorist, and he
I
had this.
remember. I remember Erickson. Yep. Go
I was
ahead.
Erikson's fun to kind of look at because you don't have to go into a deep look at it. You can just look at the timeline because certain things happen where we have like in, infancy with oral, we're learning trust versus mistrust, and then identity as teenagers, we're like, yeah, this is totally us. But I have people where they're like, uh my spouse or someone's going through a midlife crisis, and I was putting these dots together going, wait a minute, this Erickson was kind of like might be onto something where if we didn't we have a traumatic event, it would do a tick mark in that timeline. And if we didn't learn that lesson or that need, even though we're still growing, we will bound to repeat it over and over and over again. So like
Yeah.
the midlife crisis comes in, and people are like, they're acting like a 20-year-old, they're being irresponsible. They're literally playing the roles of what they thought they missed out on when they were raising kids, overworking, or was raising their siblings because parents were not available, may have been from work to being absent, whatever that is. And we will kind of try to play it, repeat what we missed out. And one of the other things that people weren't aware of, though, is that only goes so far because when I was working with uh, young teenage girls in residentials, we had a lot of neurodiverse brains, and those with neurodiverse brains tend to be delayed in those milestone experiences.
Hmm. Yeah.
So we may be mature, but we may emotionally not had the experience that because they regulate in a different experience because how they process their environment. And people go, why are they behaving this way? Well, most of us are having the same experiences, but for different reasons. So I sometimes go, okay,
Right.
where in that timeline are they? Were they supposed to be this? They might be delayed in this. And once we became aware of that, we can work on that. And it's almost like we can catch them up to a point once we kind of,
Yeah. Catch them up. Yeah. Yeah.
yeah.
Yeah.
And
Yeah.
so when you have that trauma, we go back in the family's like told, oh, you should be doing A, B, and C, and you're not doing A, B, and C. So you try to compensate it severely by the other half because you don't know any better. You're going from the references that you have from your own lived experience or what the you found online, but no one taught you how to do it or modeled it.
Hmm. That's such interesting stuff. And I get, I don't want to say pissy or, I hate when we try to blame too much, like, oh, Freudian. This is you do this because your mother was had blonde hair. You do, or you do this because it's whatever. That stuff really aggravates me, but I
Mhm.
understand like the Erickson approach more. It lands better with me that there's a bookmark, so to speak, of when an event took place in your life. This bookmark is there, and there's another bookmark later and another one. And the way you just
Yeah.
described it, and making closing that gap between those bookmarks may help you to move beyond the impact of that event, that bookmark.
Yeah.
And so I think that's really interesting. Tell us what this art is, the accelerated resolution therapy. I've never heard of this one.
Oh,
And it's big for your work, right? It's a big part of what you do.
I love accelerate. Yes, I love art.
All
Accelerate
right.
resolution therapy. I'm advanced trained in it. Um,
What is it?
So it is a bilateral desensitization. So most people probably know EMDR by
I've
terms.
heard, yeah, we use,
Yeah.
yes, a lot of the clinicians in my office are big fans of the EMDR, which
So
I
but
don't really completely, eye movement, that
yeah.
concept.
So here's the to kind of give it in this simplest nutshell. So EMDR is good for trauma work. However, the problem that happens is a lot of the clients will not finish it, and there's not a lot of control after you leave a session because it takes like 6 to 8 sessions to work on one thing. ART was accidentally discovered while somebody thought they were doing EMDR, the
Ah,
founder. And what it happens is we activate the nervous system and we calm it down. We kind of get to do wordplay and you get to rewrite how you respond to the event that you're struggling with. It helps with anxiety, depression, phobias, PTSD, uh, relationship issues, to name a few. They're working on one for ADHD. I had one where I actually worked on my dyslexia and I found out it
hmm,
was tied to anxiety. I was like, oh my gosh, this is great. Um,
hmm.
I loved it because it be used in one regular therapy session and it ties
And
it up
how
in a
does that,
nice
what does that
example.
look like? What is it?
What is it? It's a not so they both use bilateral eye movement. That means you're like tracking with a hand or
Yeah,
an
finger,
object because
right.
what happens is we actually are always trying to problem solve in our sleep, okay? And we know REM sleep is where our eyes move when we're sleeping. What happens is when we're doing that, we're accessing our back of our subconscious and it's processing, trying to figure it out. I always like to explain how when we're in our dreams, we have nightmares. The reason why we're having a nightmare is because we're being activated with our emotions and we can't handle it when we're actually trying to problem solve it. So we get stuck. So it's just like a normal therapy session. You'll be talking like a normal person, but I will give you some guidelines to focus on while doing the eye movements. And what we found that if even without the ART, the bilateral, just by tapping or walking or putting points, following your eyes to left to right, it actually, the eye movement actually is the thing that calms down the nervous system because it's connected to our brain and
Well,
on
is
down.
it based on the idea that the eye movement is something that you have to do almost conscientiously, not conscientious,
Mhm.
consciously, you have to do it. You have to move your eyes to follow something, freeing the brain up in the back to do the heavy lifting and to the cure, the healing. Is that? kind of what
Well,
it's
here's the funny
doing?
thing. This is a truth. When we're thinking, we're already scanning. We're already looking left to right because we're like accessing things in our brain. So we naturally are unaware we're doing that naturally. We're just giving a safe container where they can process, and that we let them think about it. We bring it out, and then we just kind of go, okay, and we get them to scan their body, see how they respond, how we rewrite it, because a lot of times it's just that reactivity trigger. So we're not changing what really happened, where we're changing the way we respond to the situation or what we perceive the situation to be.
Gotcha, gotcha.
Th- this
And
is
it's interesting. I've
it's,
never
it's
met anybody
phenomenal.
that practices it. So
Well, it's getting better, well known. They've been doing studies, and this thing was so. I mentioned that I am a survivor of that assault, and when it's the training, we have to actually do ART training on each other. I went into a room that activated me because the situation. I was like, because I had my coping skills, I still have it, but I still would get those moments of my body would react, and I was like, oh dear, I got to do something. I'm gonna have 3 days here. So my first ART session was based on my reactivity to that stimuli that activated my trauma response. And the next thing I know, the next time I was in a situation again, my body didn't react. I was like,
can
this
you
is the
talk about
first.
what those stimuli were, or is that too?
Yeah,
Oh,
so I had been assaulted in a situation where it was supposed to be massage, and so it was I was in going into a massage room. It was a massage table, and the instructor was a male, and I was with uh, three other women. But it wasn't that I was alone. It was I had the table and the male together, and I was like, oh, okay. And I knew why I did it and why I respond. And I could have gone through my coping strategies like usual, but how better test the thing that I'm being trained in than to use the thing that I'm being activated the most.
well, that'll make you a believer quick, right?
Yeah. And then watching
Wow.
other people heal from it. And I have worked with so many clients that it's been a game changer. It's like they come out on the other side, they're like, Danielle, oh my gosh, I go, I didn't do it, you did it. I just read a script and just created the
Yeah,
container.
yeah. And that's pretty cool. I mean, that's holistic to me, right?
Yeah.
It's letting the body heal itself, let the mind do what it's supposed to do, giving it the freedom to do that. And there's such a place for that. And and we I think we poo-poo. I know that I do, admittedly, poo-poo a lot of the holistic things because I don't know enough about them. But recently I met a guy who is pretty well known internationally for energy healing. And man, the guy blows my mind with the things he knows about me without knowing them about me. So actually that kind of brings me right into what I wanted to end with you for, a good 5 or 10 minutes here as sort of a teaser, because I know that I definitely want to get back on with you and talk a full hour or 45 minutes with you about this. But holistic, this gentleman being able to know that there was something wrong in my body that he was spot on about, and identifying it also with a family member that he was spot on about. Um, but you and I both have a shared obsession, passion, hobby, if you will. Mine is strictly based on watching television, and that is the paranormal. So I'd like to know, talk to me about why you're so into the paranormal. And then as sort of a teaser, sort of let's talk a little bit about how you actually experience that in your work or people experience it through you. And then we'll leave it at that and we'll do a whole other talk. If that's okay with you, we could do a whole
Oh,
other.
absolutely.
All right, so let's hear this. This is going to be good. Let's hear
Okay,
this.
ready for this one?
Um,
I'm actually a paranormal investigator. I am actually a real ghost hunter.
you're one of those. I love
Yes, I
that.
am. So why I love paranormal so much? Well, I was having my own experiences. I'm actually a gifted psychic medium. whatever you want to call me. I'm sensitive. And yet I'm doing this clinical work. So I was having these paranormal experiences at these care facilities. I'd have clients that or residents had passed away. They'd come and visit me and appreciate what I was doing with the care that I was giving them. And also, things I was seeing as a child, I couldn't explain. I thought I had an active imagination, but I would be walking down the street and somebody would yell, Danielle, I'd be looking around like, what? Like, what's going on? So I have had these own experiences, and that's one of the things where I was seeing that there was trauma in those people that were having this paranormal experience because they didn't want to be called crazy. Like it's all in your head kind of thing. And then there was this overlapping gap. And there's also this the part where people are like the whole family is experiencing like they get ostracized. I'm like going, no, these things are happening to people or perceived things. And even if they already they do have a diagnosis of schizophrenia or something, they could still be having paranormal experiences. I actually worked with somebody
I've
that was
always
having
thought
that
that.
duality.
Yeah, I've always thought that there was something else there. I honestly, that is amazing. And as a therapist working with somebody in a therapeutic session, I could totally see as a medium, I could totally see where, grandpa would be coming back and saying, yeah, that's my granddaughter, and she's going through this because in 1865, when I was in the end of the Civil War, this happened, and this is a, I mean, I completely, and now, okay, so you openly talk to your clients, patients that this is something that you are versed in, and you can, if they're open to it, use this as part of your uh,
The whole thing. So,
therapy, the whole
so
picture.
here's the delicate dance. When I talked about licensing and things like that, I cannot promote that I'm a holistic medium therapist because that is dual roles. If you're going to come see me as a clinician, you get me for the therapy and everything else. But if you're coming to me for the holistic coaching or healing for people who are international, because I can't treat technically mental health outside of with the diagnosis outside the state of Utah without my license, you get the whole me. Either way, you're getting me. And I'm not always telling you that I have these gifts. But if the client says, I have this, I can tell them I have references, or this is what I've been trained in, or these things. We can tiptoe into those conversations because it's about the client, not me. The moment I make it about me, then the trauma work of trauma care that I bring forward is not going to be as effective because it's
That's a
about the
really
client, not
good
me.
point. That's really insightful on your part to realize that. And I mean, that's so important that yeah, you have to separate your superpowers from what you want to impart upon your patient, laying on a couch, Freudian euphemism.
I actually had couches, but I only a few laid on the couches for
Yeah,
fun.
I know.
No,
I
but
can
I
imagine.
do. I can feel those things. I can do those things, but I'm also human, and I'm going to have those healthy boundaries, and I'm going to have that healthy client professional relationship because I'm ethical. It comes down to being ethical, and that's important. That and trauma informed care is being ethical as well. And people throw this around like I'm ethical. I'm like, how are you ethical? Who's your checks and balances? Who's doing this? Who's doing that?
Well, and yeah, who are you being ethical to?
Yeah.
Which God are you
So
answering to?
right. So if a client says, I have had paranormal experiences, like, oh, let's talk about it. I've
Right?
had dreams, let's talk about it. I'm like, oh, well, I have some experience and references on this. Let's use that. And if I don't, I will be honest and tell you. I'm like going, but I will find out and I'll let you know what I do find out.
Yeah. Well, that's the best thing. I mean, I think that's the best lesson a lawyer could ever give another lawyer is if you don't know, say you don't know, but you know how to find out and go ask
Right.
somebody
I
else. Oh
mean,
my God.
I have resources. I mean,
Yeah. Yeah.
we all do.
Well, and you have a whole paranormal index card to call on if you have to, apparently.
I do. I mean, some of the things that I've witnessed, even in child welfare and the homelessness and the special needs, I'm like, it's actually more beautiful than scary. I think
I'm
the scary
sure.
part is when the trauma distorts the experience or what's happening. And that's the scary part.
All right. So folks, you can hang on and stay tuned for when Danielle is going to come back and she's going to talk to me about how she integrates her psychic connectedness in helping others and particularly helping people in need and caregiving. And I love it. I'm really happy that we got to talk so much about trauma being more than just getting hit by a car or more than just a sexual abuse or a sexual attack, because trauma is it's not something that you get hurt and it it heals. It's something that's a bookmark, as I call it, that lives with you. And I'm happy that you were able to sort of flesh that out for people because it's a very important distinction to understand how we do all have trauma, and even if it's a tiny little thing like I don't know, I can't come up with something, just getting scared, having an earthquake and getting scared to death over it, it's something that's impactful to you. So thank you for helping me to lay
Absolutely.
that
Thank
out
you.
in a way that makes it more accessible and understandable to everyone as opposed to, oh, well, that never happened to me, right?
Right.
So thank you, and we will certainly be talking again. And I think it's interesting and fun, and maybe it's more can be more lighthearted of a conversation than some of the normal conversations I'm having with people, frankly, because it's I think the whole paranormal concept brings in a to me it's a hopeful aspect of our mortality and our ability to treat and have our mind and body and soul sort of all interacting with each other.
Yeah.
So thank you for being here. Thank you for the work you're doing for other people, and we will hear more from you.
Thank you. I appreciate it.